Communication skills. Station number 4. One of the most important stations in PACES exam. Many of the candidates feel difficulty in this station. Why? It is one of the easiest stations if you know exactly what you want to do in this station. It is total 25 minutes. 5 minutes between starting the station and entering inside the room. So 5 minutes outside and 20 minutes inside. These 20 minutes are 14 minutes between you and the surrogate, 1 minute of silence, and 5 minutes discussion between you and the examiners. If you use this 25 minutes properly, you will get 16 from 16 for sure. Just make sure that you are confident enough, not stressed, and you can read your scenario probably to know exactly what is the approach that you need to use, what is your scenario speaking about, and to catch the hidden agenda inside, because every scenario has hidden agenda inside. Let's start by the 5 minutes outside. You will have the scenario and you have an empty paper and a pen. You will write in this empty paper the main point that you will use inside to make sure that you will not miss anything. Let's start by the first thing that you should do once you enter inside. So whatever your scenario, you need to know that the first thing is introducing yourself. You need to introduce yourself by 2 identifiers, your name and your title. The second step, whatever your scenario, is identifying your patient or the relative of your patient by 2 identifiers. If you are speaking by your patient, to your patient, so you need to identify your patient by the name and age. If you are speaking with a relative to a patient, so first of all, identify the patient itself by 2 identifiers, name and age, then identify the relative by 2 identifiers, which is the name of the relative and the relationship between the relative and the patient. So you are writing in the paper outside. My first step will be introducing myself. My second step will be identifying my patient by 2 identifiers. In your practice, use multiple names to make sure that in your exam, you can use the exact name given to you in your scenario. If you are practicing by the same name, so in your exam, you will use the same name and it will be catched by the examiner, and the examiner will decrease your mark, and it is a story happened many times before. So this is the first step and second step. Third step, read your scenario well to know what it is speaking about. You need to have the sense of understanding your scenario. You need to have this basis smell, how you can smell your scenario to know it is a medical error, or it is a complication of a medication, or it is breaking bad news, or breaking bad news plus counseling for a disease, or breaking bad news plus counseling for a disease and counseling for a medication, or breaking bad news, counseling for a disease and counseling for procedure, or breaking bad news and counseling for a disease and counseling for an operation, or it is special types of the scenario like needle stick injury, or like scenario of addiction, or like scenario of HIV. So we have many types of topics. We need to catch it outside. And we need, when we are reading the scenario in a very non-stressed, relaxed manner, to build up our approach and to know exactly the main topic and the other topics. So main topic may be breaking bad news, counseling for a dying patient, cancer, metastatic cancer, and the counseling for palliative care treatment. To reach this point, we need to justify to the relative, mostly it will be the relative, why we will not do any operation or chemotherapy or radiotherapy to reach the point of palliative care. Once we reach the point of palliative care, make sure that you are covering also the DNAR. Do not attempt resuscitation. Don't forget, according to your scenario, read it well till the last point, because there may be a hidden agenda in the last point. Like if we are speaking about brainstem death, So maybe a hidden agenda of organ donation. You must know how to deal with legal issues and ethical issues well. You must differentiate between legal issues and ethical issues. Don't forget that inside, after you are making step-by-step approach to your patient or to your surrogate, by introducing yourself, identifying your patient, the open question, then start to give the real story and the real topic and the other topics that are associated with the main topic, then go for the social history. At certain time, there will be the hidden agenda. So the hidden agenda will appear inside. This hidden agenda may be hidden agenda of legal issue, may be hidden agenda of ethical issue, may be hidden agenda of another topic which will be raised inside by the surrogate. After dealing with the hidden agenda and after finishing the social history, there is the concern. You must address the concern of your surrogate. Maybe there may be 2, 3, or 4 concerns. Even if your surrogate gave you 5 concerns all through your approach, after finishing the social history, you must ask again if he has any concerns to get the full mark of the concern. Don't forget that some of the candidates asking about or making a summarization and recapping from the surrogate before asking for the concern. If you have time for that, it's well and good. But if you don't have time, if the examiner told you 2 minutes remaining, so already you passed 12 minutes and you only have 2 minutes, please ask for the concern before summarizing and recapping. The most important part after 2 minutes remaining from the examiner is asking for the concern to address the concerns properly. In addressing the concerns, please never ever to give false hope, never ever to give false information. Please don't invent any answer. Answer according to your own limitation. Some concerns are beyond your limitation. In all station 4 scenarios, don't forget that we are dealing by a multidisciplinary team to the patient. It's not you. You are one of the members. Always you are one of the members. Don't forget that there is other teams. Don't forget there is hidden topics needed to be covered when you are covering a station 4 scenario. Like in scenarios of operation or procedure, you must speak about the consent. So if you are not speaking about the consent, it means that you will not get the full mark. So every topic has its own hidden agendas and hidden topics. Don't forget concerns must be covered before finishing the 14 minutes. Summarizing and recapping, it's well and good if you have time. If you don't have time, please bypass it and make the concern, address the concern first, then summarize and recap. You have after that 1 minute of silence, then 5 minutes speaking with your examiners. In speaking with your examiner, you must be relaxed, calm and confident. He will ask you to summarize for him your performance. So please summarize your performance in a professional manner. He will ask you about the ethical and legal issues. He will measure your understanding about the legal issues and the ethical issues and how to differentiate between both of them. Some of the examiners will ask you about medical issues in the discussion. So answer your examiner whatever he is asking you. Ideally, in station 4, they will not ask you any medical issue. But if your examiner insisting to ask about a medical issue, a treatment plan, so you must answer him probably. In your station 4 scenario with your surrogate in the 14 minutes, please don't ask about past medical history. Please don't ask about any diabetes mellitus or hypertension or bleeding tendency before. It is not your role in station 4 to cover medical issues. Your role in station 4 is to deliver the message given to you by the Royal College. So you need to digest this message properly in the 5 minutes before entering inside, then deliver this message in a relaxed, non-stressed manner. Very important issue also in station 4, you must be completely sympathetic and empathetic. Don't be aggressive with your surrogate. Don't face anger with anger. Don't face aggression with aggression. You need to use your communication skills to calm your patient, to accept his anger, to justify for him why this error happened and how we will investigate to prevent this error from happening again, and how we can offer him another help if he need to correct any medical issue happened due to this medical error. If your surrogate asking about a hidden agenda, as I told you, this hidden agenda need to be addressed. Example of hidden agenda: after you completely finish the approach of the medical error and tell him all the types of investigations that you will do to make sure that this error will not happening again, he may ask you that I want to submit an official complaint and I am not convinced by all what you told me. So at that time, after you finish the approach completely for the medical error and giving him all the types of support and help to overcome and solve the problem of a medical error, at that time the hidden agenda appear. I am not convinced and I want to submit an official complaint. You need to know how to deal with this hidden agenda, how to address this concern in proper manner to get the full mark. Many types of hidden agenda are present in the scenario of session 4. You must practice more and make sure that you understand all types of hidden agenda that can be appeared in your PACES exam. Till we meet again, all the best for all of you. I hope I summarized for you what is station 4 because I received many requests about that. Practice more and more and more, and all the best for you.